All right, so we probably have a few more that might be straggling in here, but yeah, thank you for being here. We're going to talk about posture. I'm looking around in a posture class. I like to see who's sitting up nice and tall.
I just sit down on the couch.
I'm just observing. That's all. Just observing. It's interesting because I see spine problems and posture problems all day long in my practice, and so I think my kids get hounded more than other kids, maybe a little bit, maybe a little differently, hopefully, but yeah, posture's on my mind quite a bit. Not that I have the best posture, but we're going to talk about posture. So, cool. Let's see if this works. So, slouching now, struggling later was the title of this workshop, and basically, I wanted to. We see a lot of kyphosis and structural problems with posture, but I wanted to talk about general posture. It's a big thing now. I mean, if you search posture online, you've probably seen a lot of things following you, like posture braces and other things like that. And so it's something that's pretty common, a common question that I get. So I want to talk about how it affects our long-term health, because I think it really does affect our long-term health. So a little bit about me. A lot of you may know me a little bit. Jared probably knows me a little more than most. But I've been a kyphosis and scoliosis specialist since 2014. And I opened this practice in 2015 so I could focus on spinal deformities. And at the time, I also treated a lot of runners, and that was like my other side gig. But I also host a podcast, The Scoliosis Experience. So if anyone wants to be on a podcast, I'd love to interview on the scoliosis experience. I'm trained in the Schroth method and C's approach, both of which are posture-related spinal deformity treatment techniques. I'm a certified orthopedic specialist, and I'm a member of SOSORT. SOSORT is an international community over kyphosis and scoliosis treatment. So it basically just means I get to travel to cool places for conferences. So this last year the conference was in Croatia, which was, darn, I have to go to Croatia. Next year it's in Italy. That's a rough one too. So, but at those conferences we talk a lot about current research on scoliosis and kyphosis treatment. Posture isn't always kyphosis, a structural kyphosis, but it can definitely be associated with that. I'm a verified kyphosis and scoliosis nerd.
What is kyphosis?
Oh, good question. Kyphosis is the rounding of the upper back. So sometime we'll talk more about that. But kyphosis is when you talk about, I heard someone that came in talked about the Hunchback of Notre Dame. I won't say who it was that was saying that they were the hunchback, but that rounding of the back is called kyphosis. So,
That's me, I have it.
okay.
I also have severe lordosis as well, which is...
They usually travel in pairs.
Yeah.
Yes. So we'll get into that a little bit more. I'm married. That's my wife in the back, Dion, and I have 4 kids. And it's interesting because a lot of people, a lot of my patients come in and they're like, "Oh, are these all your kids?" I'm like, "I do not have that many kids." But these are all patients of ours who have scoliosis or kyphosis that send in pictures of them being active. You'll see them around the clinic, because it doesn't stop you from doing, well, it shouldn't stop you from doing things that you enjoy. So that's about me. Any questions about me? No? I'm pretty boring, really. So a question, why are you here? I could do an hour and a half, I could do 2 or 3 hours on the spine and posture, but that's not really why you're here. You're here to get something out of this. You signed up for this because you have a question or 2 or 3 or more. So I want to write down those questions on what you want to get out of this, so I make sure that I hit those things. So all right, so that's why you guys are here. I like that. So first of all, what is good posture? And I put good in quotes because I think everyone has their own idea of what good posture is. Is it, really straight? Is it arched at the back? Is it just pulling your shoulders back? Is it just not slouching? What does that even mean? Sitting straight. What does sitting straight mean? I talk about that with my scoliosis patients a lot. Like, you don't have a straight spine. What does straight actually mean? There's a wide range. Have you guys ever been confused by that? Like, what is good posture actually? Or maybe everyone knows what good posture is. I think we all have our own
There's
thoughts.
a standard definition of what good posture is. So
Right.
maybe we just don't question it.
Right. And so we can go over more like specifics of what ideal posture is, but we're not all shaped the same. And so if we say there's an ideal posture, I think we miss a little bit. So why do we care? Why does it matter if we have good posture? Wouldn't it just be easier to sit in our recliner with our monitor on the ceiling, right, Jared? But why do we care about it? I think there are multiple reasons. But I asked ChatGPT. Who uses ChatGPT? I use it like every day. But I asked it what is good posture. I actually just asked it that question, and this is what it said. Good posture means your body. Oh, I said, what does good posture mean? Good posture means your body is aligned in a way that minimizes stress on muscles, ligaments, and joints. I like that. Both when you're moving and while you're still. I really like that part. It allows your muscles to work efficiently, keeps your spine in its natural curves, and helps prevent pain and fatigue. So I think that's a pretty decent definition for what good posture is. The things that I really like in this, it's both when you're moving and still. We think about posture most of the time, I think, when we're just in a sitting position or in a standing position. But posture also follows us when we go into movement, when we start to walk, when we're running, when we're doing anything, playing with our kids.
Child, yeah.
Yeah, our posture is still there. And so I really like that part. And the spine has natural curves in it. And I think we need to remember that. David, you asked what a kyphosis was. So we have the pelvis, we have the lumbar spine that curves this way. And Janelle, you talked about, that's the lordosis. And that can be increased. We have the kyphosis that goes this way. So that's what we normally notice when someone is sitting forward, is the rounding of the upper back. And then the cervical spine will see curve this way. So we have natural curves, and we want those curves. We don't want to eliminate the kyphosis, and we also don't want to increase the lordosis too much. So it's kind of a fine balance. Yeah, Lenny?
So it has something to do with your neck too, because you can bring
Oh,
your
yeah.
neck forward and back. And I see when I look at people that are like that,
Mm-hmm.
if you bring your neck back probably, but how do you remember to bring your neck back?
How do you remember to keep it?
Back should it go?
Right. And we'll get into that a little bit more, because as we're more forward, that's where the pain and the fatigue set in. So those who want reminders on how to maintain good posture, is it just because you want to maintain good posture? Is it because you have soreness or issues associated with it? Or is it just to get your wife off of your back, telling you to sit up straight? Could be multiple reasons. So I was actually really impressed with ChatGPT's answer. And it's getting better and better. Soon it's going to take over my job, and I'll just have it do workshops for me. Jared's like, I'll program that for you. So what can poor posture cause? Many things that it can cause. Neck pain, headaches. I think neck pain and headaches are like 1 and 2 for me. Back pain, definitely. Sciatica, reduced lung capacity, rotator cuff issues, nerve impingement. Some things that people don't normally think of are like carpal tunnel. Carpal tunnel is it's a compression of the nerve here, but it also is how the whole system is pressing on that nerve. Self-esteem issues, I put that there. Some people with kyphosis or posture issues have self-esteem issues. I have, you'll see a picture of kyphosis spine here in a little bit. but one of the hardest things is a kyphosis patient who's a teenager, and especially females, because they get very, very self-conscious about that. I think boys, it's like, they're gonna slouch anyway, but I feel bad for especially teenagers who they're going through critical times in their lives and their posture is a challenge. So, yeah, anything else you guys have seen posture cause?
What's kyphosis again?
Kyphosis is the rounding of the upper back. So I'll show you a couple of pictures of that. So those are the things that I see. So great, it can cause issues, but what do we do about it? That's why you guys are here. To determine what we do about it, we have to first identify the cause of it. If we just start throwing things at something we don't know why it's happening, we could totally miss the mark. Does that make sense? So we are going to go through a little bit of anatomy, a little bit of talk of what could be causing it, why the bad posture is there. And I put bad in quotes because I don't necessarily think of posture as bad or good. There's a huge variety of postures. Postures that are increasing symptoms or problems and postures that aren't. So, okay, what causes bad posture? I see this as two things. One is structural problems and one is functional problems. So for example, the picture on the top right, is there too much of a glare on that, or can you guys see that okay? You can see it? There's a good glare?
Yeah,
Oh.
we got it great.
Okay, we're good. So top right, that's more of a functional posture issue. So he might have a structural problem underneath that, but functional is weakness, tightness, reduced awareness of what's going on, ergonomics or environmental influences that put us in a forward posture, those things. So functional is something that's not set necessarily. Structural, this is where we get things like Schurman's kyphosis. Those who know what kyphosis is, do you have Schurman's kyphosis? No? Okay. You just might not know it. Vertebral fractures can cause more of a forward posture because vertebral fractures, like in osteoporosis, will fracture the front of the vertebrae, and those vertebrae start to collapse forward, and we get that rounding forward. So that's definitely a structural issue. Scar tissue, I see scar tissue create a forward posture with like people who've had heart surgery, where they have a lot of scar tissue and are protective. Abdominal surgery can be that way too, things like that. And then scoliosis can definitely cause asymmetrical posture, which then can create pain in that. So we have to determine if there's a structural component before we treat that, because if we're trying to treat a structural problem like a functional, it's not as effective. Okay. So structural causes. Let's go over this because I think this is important. Up top, that's the vertebral fractures. I already kind of showed you that. You have a fracture of the vertebrae, and that causes you to go forward. On the bottom here, this is Schurman's kyphosis. So you can see, this has a laser pointer, but I can't see on the screen. Right through here, you can see that there's changes in the vertebrae that create more of an angle. So when that person tries to pull out of that posture, they're fighting structure. They're fighting the shape of the spine. So this is bone, joint, tendon, ligament, scar tissue. These can be very tight. Like these can be very tight spines. And they need specialized treatment and specific techniques to help them pull out of this. So with structural problems, we have specific ways of treating that. Functional causes, I thought this picture was kind of funny. It's like good posture, bad posture with each person, but I don't know, you see a variety of issues with posture through there. But functional causes can be weakness. So if the muscles aren't strong enough to hold you in a good posture, or more importantly, if they don't have enough endurance, because that's what we really need, strength, everyone probably has enough strength to get in that posture, but the endurance is the issue. Tightness I think is something that a lot of people don't understand why it affects it, but if things are tight, limiting you from going into a good posture, you're going to be fighting that tightness all the time, and we're going to get more muscle fatigue. And so we have to address tightness as well. That's a big one. Bad ergonomics. Ergonomics can definitely affect our postures. And stress. How many of you feel like your posture gets worse when you're stressed? Yeah, man thinks that, dude thinks that. I know I do, you know. Environmental, like how your setup is. I had a scoliosis patient who, he's 25, but he has Down syndrome. And I was strategizing with his parents how to get, because he would sit where he was going into his curve all the time. And with him, it's really hard for him to have self-awareness of what's happening with his posture because he has Down syndrome. And so we found out that he would sit on the one side of the couch all the time, and he would lean onto the arm of the couch and draw on his iPad. And that was leaning into his kyphosis because it was the path of least resistance. And so if we don't change that environment where he's sitting on the other side, you know, good luck. He's there 10 hours a day.
Remind me again, and you may have said it, no one else remembers, but what is ergonomics?
Ergonomics is how your work setup is. So
Okay.
it doesn't have to just be work, but if you're at a computer for a while,
Okay.
where your keyboard is.
Ways
And
of sitting or moving or
yeah.
positioning yourself.
Yeah, so we'll talk about that. I have 3 tips towards the end that we'll talk about that can help. So how do we know the difference? How do we know if someone has structural or functional or a combination of both? Because we definitely see a combination of both things. And if you're struggling to maintain good posture, maybe you have an underlying structural problem that you just don't know about. So question number 1, can you get into normal posture? So I want everyone to get into what an ideal posture would be. You're already there. So can you get into that posture? If you can't get into an ideal posture, we haven't really talked about exactly what that is. But if you can't get into that position, then we probably have a structural problem that's blocking you. If you can get into that position and it's just uncomfortable, jury's still out. We might have some underlying problem or not. But if you can get into good, nice, tall posture, you probably don't have a structural reason for that. Number 2, you can relax if you want. Number 2, how stiff is the spine? When we have structural problems, we have a lot of stiffness in the spine, whether that's scoliosis or kyphosis or whatever. We have more tightness in the spine, and how we assess that is we have someone lay on a table and we just kind of push and feel around how much stiffness there is. That stiffness can stop us from being able to pull up into a good position. So we need to know that. More stiffness and structural problems. How sharp is the angle? So the kyphosis angle, if we have an angle that's just really significant, especially over 55 degrees, then it's most likely a structural problem. Or there's at least a piece of that to the puzzle. So, and then do you have imaging? If you have imaging, we can totally tell if there's deformed vertebrae or something like that that's contributing. But we have to know that before we really address what's going on. So, sometimes it takes seeing someone to determine the cause. So I put up here, orthopedic physicians can usually diagnose this. I mean, they can do an x-ray. They are used to looking at this, especially spine specialists know what they're doing with this. Physical therapist, if they're specialized in this, you'd probably be surprised in PT school we get, I don't know, maybe half an hour of instruction on scoliosis, kyphosis, spinal deformities, things like that. So I was just a general orthopedic PT for 9 years before I opened this practice. I don't think I knew even what Schurman's kyphosis was. I knew what kyphosis was, but I didn't know the structural reasons that would be with this. I put a question mark on chiropractor because I think sometimes, well, has anyone been to a chiropractor and done a scan or an x-ray of their back or spine?
My neck when I had that side.
When you had that? Okay, Mav, you've done that. So what I usually see, I call it the red line of pain and the green line of happiness. They'll do an x-ray and then they'll put the green line for where your spine should be and the red line for where your spine currently is. And it's pretty common to see a few things. They'll usually tell you that you have a straight neck, like that you've lost the curve in the lordosis in your neck, which most of us, if we're on phones, we've actually probably lost a decent amount of that curve. But then my problem is when they discuss that, they don't give you a lot of proactive ways to treat that. It's a lot of passive manipulation and things like that. So if you're going to a chiropractor for posture, make sure that they're giving you things to do outside of those visits, because that's where the real magic happens. It's not manipulating the spine.
I have a question about
Yeah.
chiropractors. I haven't really been to one. One time, like 40 years ago, I had a stiff neck and I went and he went like this and jerked my neck and killed me. That was better, but I hated him, so I've never. I was going to
Did you say it was better, but you hated him?
Well, I hated him because I don't think that's good to pop.
Okay.
I've never gone back. I always go to physical therapy. So which is
Right.
better for you?
So obviously I'm a little biased. I think chiropractic is fine, and we use manipulations as well when things are tight and need to be unstuck. I think the biggest difference is when that's all that's happening. I want someone to get past that, and many of your questions are how do we self-address this? And I think that's where it's limited.
I've never had a physical therapist do anything that was, very forceful.
That made you hate him, right?
No.
No, I'm just kidding.
I have a physical. I've never gone to one yet. I thought
Right.
that was freaky.
Right.
It
Some
just pop you. It could have been the wrong thing. They popped.
it can be helpful if it's done for the right thing. So I mean, getting it evaluated, I think, is helpful. So for both structural and functional, so this was PowerPoint has a little AI thing that'll design different slides. So I had it just design this slide. But it's interesting because stretching has more of a strengthening picture. Strengthening has like a graph. Biofeedback, okay, I get that. Manual therapy, it has books like manuals. And then mobilization, I don't know what, people moving, I guess. I don't know what it is. But those things are things that we use for both. So stretching, we already talked about the stiffness. Lengthening, strengthening. Biofeedback, what I mean by that is something that reminds you about your posture. And I had a couple of questions about that I want to get to. Manual therapy, like manipulation, like a chiropractor, but trying to loosen things up to get the mobility so you can get in that position. All those things can be helpful for both. So we're gonna talk about some specific tips, and I have a free thing that you guys can take advantage of if you want. So for structural, we need more specific treatment. I thought I'd show because I talk about Schurman's kyphosis. This is Schurman's kyphosis. So this kid, if you look at the angle of his back, it doesn't change a whole lot when he's standing up to when he's bending forward. But bending forward, you definitely see that sharper angle at his back. So this is classic Schurman's kyphosis. This is, for him to get in good posture, it takes a lot more. And so this is an underlying structural problem like I'm talking about. For that, we use the Schroth method. The Schroth method has been researched. It's specialized. You have to be certified to truly do the Schroth method. And it's postural retraining. I do use the Schroth method with general functional posture issues as well, because I like the retraining that it does. because I think, like Jared was talking about, you hear you can strengthen these muscles and they'll hold you in good posture, but then what? I mean, okay, now your muscles are strong, but your posture is the same. So it's retraining, and we use this method to retrain that. I've been doing that for 11 years now. It's been really cool. Both of them may need manual therapy, more intense retraining, and a specific program for each person. So everyone's different. I mean, just talking to you guys and observing you guys, there are different postures here. And while I do a workshop like this, I see how people move as well. Like, because that indicates to me where you're comfortable or where you're not. So we have a lot of differences and we need to structure those that way. So let's talk about other helps. I put 2 of these up here. Who's seen a posture brace online? Who's looked up posture braces online? Who doesn't know if they work? Who's curious about that? So I get asked this question almost every day now. And so I actually did a YouTube video on whether or not posture braces are effective.
They're not.
They're not.
Just hurt your shoulders.
Okay, tell us about that. How long did you try one?
I've actually tried probably 3 or 4 different over the years.
Yeah.
And I will wear it for like 3 or 4 hours, like doing housework and stuff. But I usually just end up having pain on the front of my arms, and I don't like
from
it
where
to
it's like
stop. Yeah.
trying to pull you
I
back.
don't feel like the stiff back part
Yeah.
actually helps my back. It just feels like I mean, they pull your shoulders back.
Yeah.
It reminds you probably, but I don't think the back brace thing helps at all.
Right. Okay. And that's great. Anybody else have tried one? No? Just seen them on searches, right?
Coming up with the ads.
Just see them on ads.
Well, because
What?
the person's always like this.
And then they put it on and they're like amazing posture, right? So I have a love-hate relationship with them, and let me discuss why. They will hold you in a good posture, but sometimes, like what Janelle's talking about, we have pressure that's too much some places. Like, let's say your back is really stiff and that posture brace is pulling your shoulders back. It's going to pull the weak link. If your back is really stiff, it can't get a whole lot of pressure in that to really reduce the rounding of your back. So it's going to pull your shoulders because your shoulders are more mobile. So is it actually addressing the area that's the problem? Maybe, maybe not. For someone who has postural issues that, like say they're at work and they just can't maintain good posture, this can be a decent reminder. But I like to go very low level in how much force it does. Kind of more of a minimalist brace. Kind of like minimalist shoes. Jared and I have talked about minimalist shoes too. If you support the arch of the foot too much, the muscles that normally support the arch atrophy and take a break. It's the same way with posture braces. If we support posture too much with a brace, the muscles that are designed to do that get weaker because they don't have to do it. It's the same thing with wearing a back brace all the time. It weakens the core. So we want the muscles that actually do this to do it as much as possible. I do have some patients that I recommend this if they're just so weak or there's a lot of challenge or there's a lot of pain, just to get them out of that while we work on the strengthening. So this is not an end treatment. These posture braces, I never use them as an end treatment, but sometimes we can use them during treatment. Does that make sense? Any questions on those? So I know you guys have seen those. I know that I used to say I just didn't like them because I wanted the muscles to do it, but I've used them during the course of treatment with some patients.
Didn't you tell me that they have to be for your body?
They do have,
A general.
right. And I think we were talking more about scoliosis specifically. Scoliosis braces, there is not a good over-the-counter scoliosis brace. There's just not. And I wish there was. But I think in 2 years we'll see 3D printed braces come out that then we can make them more custom. They're already in, that's why I was in Croatia, was there's a group there doing 3D printed braces, and they're pretty cool. They're pretty awesome, but they're not really available yet. So this Upright Go 2, it's where tech kind of meets posture. There are a few things like this out there. I just picked this one because it's the one that's been out the longest. It's probably been out for, I don't know, 7 years. And the way it works is it's a little device. It's just that big. It's pretty small, and it sticks to your upper back. It has kind of a hydrogel on it that sticks to your upper back. And then it has an app, so then you get in good posture. What do you think is good posture? And you set that as your good posture. And then when you get out of, I think it gives you like 15-degree leeway. When you get out of 15 degrees, then it starts to vibrate, and it gives you some feedback that your posture has gone forward. And so that vibration then reminds you, and you can adjust and correct for that without having to think about it all the time. And then you can even, one of the cooler features with it is you can turn off the vibration, the reminder, and just have it track your posture. And so like say you're at work, you're like, I wonder what percentage of my day I'm sitting in a good posture. Then you turn it on, and then at the end of your day you could see, 80% of your day you're not in good posture, or 80% of the day you are in good posture. So I do think this is a good tool, but it only works if you use it. So my teenage patients, I rarely have them use this because they get pretty annoyed by it. Like, ugh, I hate this thing, vibrating and, whatever. Their phone vibrates in their pocket all day. Maybe it's just confusing them. I don't know. But I think it's a good tool, and I think there will be more tools coming out like this. And I think there may be more tools that may have already come out like this. What I would like to see, because it's actually pretty low profile now. The first ones were quite a bit bigger, but people don't even notice that you have it on usually. I wore it all the way through Disneyland one time just to see if it would stay put. I mean, rides and everything, it held on just fine. And so I think it's a good option. When we talk about how do we do things without having to think about it all the time, how do we maintain good posture without having to think about it all the time, this may be a good option, because otherwise we're having to do a lot of repetition in retraining this. This is also repetition and retraining. I mean, I don't make anything from promoting this, but it's one of the things out there that's a possibility. Has anyone tried something like this? Yeah.
I had one called Lift probably 8 years ago or so, but it
Yeah.
was hard. It attached to like clothing.
I had one of those
which
too.
Sometimes the clothing you wore made a difference, and then I also had young kids, and so they would press them out.
Right.
And like recalibrate, so that didn't.
Yeah.
It worked if I wasn't like holding the kids and stuff.
Right. So, yeah, it was probably about 8 years ago. It just kind of clipped on, and I had the same issue with it. Like, I would lean forward and it would like be hanging out like this, It's like, that's not very accurate. So I think this one's a lot more accurate because it's right on your spine. And I mean, not many things are gonna push on that. When you lay down, you're not really worried about your posture laying down anyway. So I think it's a good option, but I would love to see more things come out in the tech space to address posture, because it is exhausting to try and keep track of it all the time. So 3 tips for posture. Let's get into 3 tips. These are really basic because I don't know what's going on with everyone here, so I don't want to give some crazy exercise and then have somebody flare it up. We don't want to do that. But here are 3 tips. Number 1, ergonomics, or sitting posture at a computer. You can also think about this as sitting posture when you're on your phone. So let's go over some specific things. First of all, environment and setup always wins. Always. So if who works at a desk? Okay. How long are you at a desk? 10 hours? Or 8 hours or whatever, sometimes 12 hours. If your ergonomic setup encourages poor posture, strengthening is not going to help this. Posture retraining is not going to help this. We have to get that in line, or it just encourages poor posture. Does that make sense? So if we're thinking about that, oh, posture, maintaining my posture, think about my posture is so exhausting, maybe it's that the setup is pulling you out of that all the time. And so until we get that addressed, it's really hard to do the other things. So I would say this is first. Before we look at other things, let's make sure our setup is good. This picture has a lot of angles on it and specifics, but if we just think about a 90-degree rule, it's kind of funny because that angle is not 90 degrees, even though it says it's 90 degrees. I'm like, somebody needs to go back to geometry. But your elbows should be at about 90 degrees. Okay, so if you're sitting at a desk, elbows at 90 degrees, ideally supported on armrests or something like that, but 90 degrees here. That means your keyboard stays here. Your keyboard does not go here. It does not go here. It stays here. We'll call this kind of the safe zone, that it stays in front of you like that. So 90 degrees at your elbows, ideally 90 degrees at your hips. So if you're sitting, the hip angle like this should be close to 90 degrees. The further we open up that angle, the more the arms have to reach. So 90 degrees here. 90 degrees at the knees, I'm not as much a stickler on because it's not always possible. I mean, I move my legs when I'm on a computer a lot, so that one I'm not as concerned about. But yeah, keep in mind 90 degrees, elbows, hips, and knees. And if you have an adjustable chair, that helps. And don't reach. That's the biggest thing. Not that you can't reach for a pen or something like that. That's not what we're talking about. But what you're doing, the more you're reaching, the more that's causing you to go forward. So, anybody have thoughts on changing something with their ergonomics?
How about driving in a car? I see people
That's
that are all
good.
like that. And I go, oh my gosh, because my back's always bad.
Right.
I push it straight up. I am a straight up
Right.
driver. And people go, what in the heck are you sitting like that?
They're probably all gangsters. That's what we used to say.
Everyone's like this. Da, da, da.
Doing that.
That's bad, isn't it? Sitting like that.
Well, sitting back like this to get to your steering wheel, you have to go forward. So your shoulders are sitting more in a forward position. If you're driving for 5-10 minutes, probably not a big deal. But if you're driving from Mount Pleasant for, what is it, an hour and a half? An hour and 15? Then you're going to have more time for things to tighten up.
I have a little travel pillow I have to stick behind
Yeah.
my back
Okay.
to help with pain because
Because it gets sore doing it that long.
it's painful.
So here, if you'll notice, they talk about back support in this, but having something to support your lumbar spine is really important as well. What do I recommend for that? There are rolls that you can get on Amazon. They're called, like, there's McKenzie rolls, there's just lumbar support rolls, things like that you can get and just put in your car. A lot of cars now have lumbar support, but they just don't go far enough most of the time because they're catering to like average, and so they're not going far enough. So you can get some over-the-counter things like that on Amazon. I think the biggest thing with maintaining good posture is trying to reduce our energy expenditure. Because if a tall posture is a ton of muscle work, it is not going to stay there. Even if you're drinking Soylent. Does that make sense? So those that struggle to maintain it, maybe it's that we're overdoing the muscle activation. Are we using the muscles that we need to, or are we overdoing that? because we're worried that our posture is going to go forward. So just a thought. Okay, number 1, that was ergonomics. Any questions on that other than what we've already talked about?
I don't know if you're going to touch on it, but what about people using one of those, what are they called again? The big balls.
The
in chair.
physio balls, the yoga balls. They can be good. Like you can maintain good posture on a yoga ball if that appeals to you. But I've also seen people slouch significantly on a yoga ball. So they don't magically fix it. You still have to maintain your posture. But they don't have a back on them. So,
Might be a good reminder.
so then your muscles have to work more, build that endurance. That might be helpful. Some people hate sitting on a ball though. So number 2, stretch. So this picture is of a wall angel stretch, a wall angel exercise. I tend to fill my walls up with stuff, so I don't have a wall to show you. But what we do with this, so this is to open up the chest and really stretch everything that could be tight. So it's a really simple exercise, but we can make it pretty challenging. So you stand, if the wall is right here, you stand with your feet just a little bit away from the wall. Your pelvis stays on the wall. Your back stays as much on the wall as you can. And then your hands come back to where you're trying to get your elbows and your hands on the wall. If you have a lot of tightness, your elbows probably aren't going to hit the wall and your hands might not totally touch the wall. But that starting position, a lot of people can start in that position. So you start in that position and then you gradually kind of work your arms up and keeping your hands on the wall and then work them back down. Seems like a really easy exercise, right? It's like, oh, we're just standing doing a slow jumping jack. But this is pretty good stretch because you're trying to maintain your pelvis on the wall. Everything is against the wall, so we can't round and compensate. And then you're just gradually going up and down. You can see this online all over the place. We have some videos on YouTube for this too. It's a great way to stretch things out and you get some muscle activation with this too. One thing to be aware of is trying to bring your head back so your head isn't forward as you're doing this. You know, you're keeping your head on top of your spine. So, quick and easy stretch. There are a ton of other stretches to do. You could stretch your pecs in the corner. You could do a foam roll stretch. But getting the mobility is a big piece because we need the mobility so the muscles don't have to work as hard. Going back to, we want less muscle work and then you can hold it for a longer period of time. So, number 3 is practice. Practice sitting tall. Like we just talked with Rose, this is just a picture of like a meditation or yoga position. But if you sit tall, number 1, and you try and elongate your spine, like dancers, they'll a lot of times talk about a string pulling their head up to the ceiling. Thinking about that, just gently. And then you center. So if we talk about what good posture is, it's that your head is centered over your spine and your spine is centered over your pelvis. That should bring shoulders where we want them. Because if we try and like specifically bring your shoulders past your ear or something like that, we get too much muscle activation. So, and then once you're in that position, taking 10 deep breaths. And if we incorporate some of the Schroth method stuff that I do with my scoliosis patients, each breath should be trying to elongate your posture a little bit more. So you're sitting tall and each breath you're trying to get a little more length. We're trying to teach the body where that neutral posture is, gently. This isn't like slamming your shoulders back, which is what a lot of my older patients' moms told them.
So compare this that you're showing here to the one against the wall.
So different.
Yeah, appears different, and
Mhm.
and the other one seems to be more how you're feeling about it, where the other one is you're sensing being back against the wall.
This is more like an active stretch. So you're moving, you're going through that. Has anyone done a wall angel before? One of these?
So it's like a jumping jack, except you're against the wall and you're not jumping.
And you go slow,
Yeah.
and you're not jumping. Yeah, I mean, I can show you afterwards. But this is more of an active stretch. You'll feel muscles activating. You'll also feel muscles stretching. When we're talking about this, I don't want you to feel a lot of muscle activation. I just want you to feel that sitting tall. I've changed how I talk about posture a lot over the years. Sit tall usually gets what I'm after. Usually. So if we're talking to our kids, and it's because there's such a connotation to slouching or such a connotation to bad posture. If we just say sit tall, who doesn't want to be taller, right? There's less of a emotional response to that, and I've seen that be more
Emotionally,
effective.
it's the difference between stop this, don't do that, to do
And
this.
do this, yeah, exactly. So we get a better response. We don't get the teenager that's like, I'm not gonna do that.
You tell me not to slouch.
Not that I have any children who do the opposite of what I tell them every time, right? Just wait, Jared, it's coming. It's coming. So the free offer that we offer with this workshop, we offer a free discovery visit. What that is 30 minutes where we can sit down, talk about your specific concerns. I mean, we have specific things here. And we can talk about the underlying cause, what that might be, and make a plan to improve it. So this gives us more time to look at specifically why you're here today, basically. And then we'll do a free 4-metric scan, which is a surface topography scan, where we scan your back. It'll tell us what the natural curves are in your spine. This spine is very straight because this person has scoliosis. And then it'll give us measurements for what your posture is like. Has no radiation, it's just light. Janelle's done one of these. Anybody else done one of these? Oh, you did do one of these. Your daughter did. So they're pretty easy, quick and painless, and usually these are $85, but we're giving these in our consultations. And the cool thing with this is it gives us a snapshot for where your posture is now, so we can see how it improves after you do some things to improve it. So that's something that I would love to do with each of you. So, and Janelle, you've done one before. I'd be curious.
To see if it's worse.
No, I was going to
It's
say,
not
see if it's
gonna-
better.
Oh no, it's not going to be better. I haven't done
So-
anything.
So maybe we
It's
should
like I'm
maybe we
watching-
should do something.
Yeah, exactly.
That's-
That's why I'm here. I'm gonna.
Yeah.
I need to.
So you can.
Because there's this little old lady that comes into my store where I work,
Uh-huh.
and I feel like her head is on her chest, like her back is higher than her head,
Yeah.
and I feel like that's gonna be me if I don't stop what's going on.
Well, I mean, I have no crystal ball, but if it's gotten worse over time, what's to say
I
it's
would
not
be
going to
curious.
continue to get worse over time?
Yeah.
You
So it's
know.
probably been about a year since I did that. I'm
Yeah,
guessing.
we could check it out and see. So you can scan this code and fill out the form that's on there, or you can just talk to Dion as you leave, and she can find a spot where we can do that. It might be with me. I have 2 other therapists who are specialized in posture and stuff like that. So